Good morning. I'm Laura from Feel Good Co. I'm going to do a short introduction before we hand over and get the event started. So thank you so much for joining us today. We at Feel Good have been working within wellbeing and leadership for over 10 years, and we're experts in human psychology and engagement. We design powerful people experiences that shift mindsets. We use science to fuel people's internal development while injecting fun and creative flair for maximum impact and enjoyment. We work with amazing brands in lots of different industries, such as Oracle, PwC, WPP, Johnson Matthey, who we're delighted have joined us today, Lloyds, Prudential, just to name a few. We absolutely love to bring all industries together and these knowledge sharing events. We're aiming to host these every 3 months, and you can find out more details on our website. Thank you so much for joining us today. We're here to discuss the critical topic of mental health and inclusion. I'll hand over to Julia, who's our host for the day, and she can introduce our wonderful panelists.
Thank you, Laura. Just in terms of a quick another intro, extending from that a little bit, with the theme of the October, the 10th World Mental Health Day being mental health in an unequal world. We at Feel Good are absolutely delighted to present today's panel event of Leaving No One Behind. We knew before the COVID pandemic that there were inequalities in terms of mental health challenges faced by people from minority backgrounds, race, disability, gender, long-term illness, for example. And we now know that the number of people experiencing mental health challenges has increased dramatically as a result of the pandemic. And we know anxiety and depression across the world have increased dramatically. And just here in England, there's been an increase of 75% of people referred to mental health services for very serious mental illnesses just in the last year. So not only this, but the inequalities experienced by our friends and colleagues from minority backgrounds have become greater. And the increase in mental illnesses and mental challenges faced by our younger people and under 24-year-olds has also become a lot greater. So today we're going to hear from our panel of experts and what they've seen happening within their organisations in terms of such inequalities. And they're going to share with us some of the stories and some of the practical strategies about what's being done to help level up. And we may learn from them and each other some useful ways of what our organisations can do to improve mental health and wellbeing for our colleagues and employees. So can I introduce the panel? I'm going to go through all of our fantastic panel members. And if I can start off with you, Caroline, if you could say your name, role, and what you're particularly passionate about in terms of mental health inequalities. Caroline.
Hi, I'm Caroline Adam. I work for Johnson Matthey, where I head up their UK benefits and wellbeing globally. I've been there for about coming up to 3 years now. And one of the reasons I chose to work at Johnson Matthey is because of their passion for well-being and the fact that it really is something that is truly on their agenda and something that they really want to do. It's not just a box ticking exercise for them at all. And, and for me, that's incredibly important. Having, again, I guess for me, it's about that ease of access, that level of comfort, and creating a culture of, I guess, that psychological safety that people talk about is I know from personal experience, I worked for other companies, and I would certainly, even in my role as a well-being person, feel uncomfortable talking about any mental health issues that I might have. The one thing that's wonderful at Johnson Matthey, and increasingly so, is Johnson Matthey is a place, certainly from personal experience, I feel I can talk about my mental health issues openly, and I do, and more people do. And I think that to me is something that I'm passionate about, is working in and creating an environment where people feel they will not be stigmatized or ostracized or compromised in terms of their career or their progression because they are open about any mental health issues they will have. And I think that that is my true passion, is creating this open environment and ease of access, which I think comes with the openness.
Thank you, Caroline. We look forward to hearing more about that later. And Jackie Wilmshurst.
Hi, good morning, everyone. So I'm an independent consultant and I work in various areas. I have several passions, but I shall zoom in on a couple today. I'd say overall, what we would call parity of esteem, mental health, being able to have the attention in all different ways that physical health mostly enjoys. I realise there's work to do there too. Within that, I look at health and safety, meaning we don't want workplaces and the work people do to cause injury alongside all the other things we have to deal with in life. So I work particularly in that area. Within that, again, although it expands beyond in terms of diversity, I have quite personal reasons alongside my professional for one area of diversity, equality and inclusion that I passionately feel needs more attention, but I'm going to reserve telling you more about that for a little bit later on.
Thank you, Jackie, and it's really great that we're going to hear some of your personal insights as well. And Charles.
Hello, good morning, everyone. Absolutely great to be here today. So I'm Charles Alberts, and I lead the Wellbeing Solutions business at Aon, who are a professional services consultancy. I guess I've always been really interested in the area of diversity and inclusion and mental health. I won't go through all of the different reasons, but for in various areas of my life, I've kind of always felt a little bit other, whether that is my sexuality or whether maybe it was English not being my first language when I was at an English school or when I emigrated to another country. And I firsthand experienced kind of that impact on you when you are discriminated against for being different to others. But equally, I also know what it feels like when you get to an environment where you feel included and accepted by others, where that difference is not stigmatized. So that's led me to do various things in my career. I studied Masters in Workplace Health and Wellbeing, where my research project was on the factors that kind of help people to talk more openly about mental health in the workplace, which to me was absolutely fascinating because I think that's such a fundamental component of overall mental health and wellbeing in the workplace. I'm also one of the founding members of Aon's Mental Health Group, which is our employee resource group, and I volunteer in my spare time as a board member of my local Mind as well. So thank you for having me.
Our absolute pleasure, Charles. Thank you for your introduction. And Sandra.
Thank you very much, Julian. Delighted to be here. So my name is Sandra Kerr and I'm the Race Equality Director. Business in the community, we work with employers who recognise from public and private sector that actually inclusion of ethnicity and race in the workplace is good for business and makes absolute sense. Why do I care about this? I have known that there are huge disparities when we look at mental health and women and ethnicity, and I've known about it since 2017. That it's 29% of Black women in any 1 week would report a common mental health disorder, and it's 28.7% from women from mixed race backgrounds. I've known this since 2017, and it was on my agenda. I thought I really need to spotlight this issue. And because obviously other priorities, I hadn't, but then the pandemic hit. And I thought, hold on a minute, if in 2014, when that survey was run, it was already showing 29%, and this is in contrast to other ethnicity groups. So the white women's group is 21% and white other, which is not great either, but white other women is 16%. I thought, what is this pandemic doing? The lockdown, the issues, the economic impact. And I was around for 2018, so I know what happened then. And I really wanted this issue to be spotlighted, really, so that it can be included, because I'm sure nobody on this call remembers there ever being a national campaign to look at women's mental health, much less ethnically diverse women's mental health. So I think it's a silent issue under the radar, and we really need to bring it to the surface. So really looking forward to the session today. So thank you.
Thank you, Sandra. So before this event, some of the panelists have already shared their concerns about the huge disparities in mental health by the intersection of ethnicity and gender. And these disparities were in place before the pandemic, as we've said, and so much now about the COVID situation has made things so much worse. And as Amanda mentioned, that she's working in Guy's and St Thomas, and we know that there have been real issues for people who are actually on the front line dealing with the pandemic. And so where have you seen some of the greatest sort of challenges, and what success stories have you seen in terms of people who are working on the front line? As we know, sometimes people on the front line are receiving the lowest of pay, and this can be lowest for women and people of BAME minority backgrounds. So what have you seen, and what success stories have you seen in terms of what has been done across your organisation to try and level up some of these inequalities? And we know that actually organisations who get this kind of thing right have a real strong focus on well-being. And I just want to hand over to Caroline Adam of Johnson Matthey, one of the oldest and largest companies across in the UK. And as the local wellbeing and benefits manager, tell us what you've seen, Caroline, in terms of levelling up support for people from different backgrounds who often don't get support.
Yes, it's a big question, and I think that I'm very fortunate, we're very fortunate at Johnson Matthey that actually this idea of taking care of their employees is not something that is new to them. It's not something that sort of appeared when people started talking about well-being, but throughout the history, they've been, I guess, what you might call a fairly patriarchal, approach to their employees, taking care of them, taking care of their families. Also, we are aware that certainly, in the UK, where we have some of our largest sites, we are employing multiple families at times. So, I mean, multiple family members. So we might have, partners working together, several generations. So we're not just talking about individual employees, we're actually talking about people and their families and their social lives and the community they live in. When there's a high percentage, I guess, of employees, the people who live in certain communities that work for us as employers. So we've been very lucky, or I've been certainly very lucky coming into this role, that we had a really, really, I guess, solid foundation of caring for our employees. Now, were we perhaps quite where we wanted to be, or as current with, our approach to it? Absolutely not. Are we still there? We still have a long way to go. But I think that absolutely we've been very lucky. I think the starting point is the culture of the company and the values of the company. One of our key values is protecting people and the planet. And I think that to be true to our values, that's not just, external facing, but internal facing. And people really believe and buy into the values. So that, in itself is really important. And I think that maybe even goes back to the first point is, what are your company's values? And do you embody them internally as well as project them externally? I think that, to me, it is really a key one. And then, of course, we don't just have employees in the UK, we have employees all over the world. We have a very, very diverse population, whether we're talking about, different generations, whether we're talking about different types of roles. We have people who work on the shop floor. We have people who work in research labs. We have people like myself who sit in front of a computer all day. We have people who speak English. We have people who don't speak English. We have men, we have women, we have people at the start of their career, people at the end of their career, people with different levels of access to technology. And it is absolutely a challenge to how do you get your arms around everyone and everything, in terms of the culture, in terms of how you approach things. We were having a conversation the other day, we were talking about well-being, in our employees in China, there isn't a literal translation, for the word well-being in Chinese, in Mandarin. So, you're already just starting with that premise, which is you're trying to, I guess, spread a concept or build something based on actually terminology that doesn't actually exist within a culture. And I think it's being aware of that is, we're not saying we need to go out and, invent the word for them, but how do we translate the concept of well-being? How do we present it to our employees? When they live somewhere where, it literally is not, a word that exists. What we've done for a lot of these things is we try very hard whenever we run campaigns, whenever we do something, is how can we acknowledge the fact that, say, not everybody speaks English. And so how do we get it out in local language to people? And then again, being very careful, and we have been bitten by this, is that it doesn't feel like it's just a Google Translate exercise. If we're running a session on nutrition, it's not about translating the UK version because people's diets are very different, people's habits are very different. So how do you take that nutrition seminar or webinar and actually make it something that is applicable locally, because you're taking into account, what people eat, what's available to them, what their culture is. How do you start the conversation with people, we take, for instance, in our Latin American market that have a very sort of, that are quite reluctant, I guess, to seek help or to speak around mental health, because culturally it's perceived as a sign of weakness. It's not something that you talk about as much. So yes, we have, for instance, an employee assistance program, but we know, our stats show it, that if you're sort of European or US based, we have high uptake, high usage, because there's a level of comfort there. But nobody uses it, for instance, in Latin America. And so how can you shift the focus of introducing a program, of talking about a program, so that actually it feels like something that they're comfortable to engage with? And once you've got them engaged with it, then maybe you can push the barriers a little bit more. So, we talk about, when we take EAP, and this is just an example, a lot of people focus on the mental health support that an employee assistance program offer, and you can have counseling. But that puts people off if you talk, say, for instance, to the Latin American market, because they think, oh gosh, my name's going to be listed somewhere, people are going to find out, I don't want to do that. But actually the program is much broader than that. It offers work-life balance support, so family support, schooling support, diet support, all of these things. So maybe you need to present it a little bit more through that lens to build that trust and the confidence in the program, the confidentiality of the program, before you kind of go in there saying, well, why aren't you using it for this? The other thing that we have done a lot of is we have a wonderful network of wellbeing ambassadors, 140 wellbeing ambassadors globally, and they sit in all of our various sites. They are employees, and they are the ones who will make a corporate-led program locally relevant. And to me, that's the key. It makes it locally relevant. It makes employees feel, again, that it's for them, it's about them, it's presented in a way that works for them. Because really these well-being ambassadors are, as I always say, they're the eyes, the ears, the feet, the hands, of the well-being programs. And they're the ones who know how something may or may not land and how we can adjust it for that. So I think that, those are some of the things we take into account, and that we work, and we don't always get it right. It sounds so easy and so straightforward when I talk about it, but, of course, it's an iterative process, and we work at it and we try. We also have to take account of people not having necessarily access to technology. So it's very easy for me at my desk. I have a laptop, I can access all the information I want, but we have employees who, don't have a Johnson Matthey email, certainly don't work on a laptop. Some of our employees, because of the nature of the work they do, they work on secure sort of metal-free sites. So they wouldn't even necessarily be wearing a watch, let alone carrying a phone that they could access information through an app. So working with local people to make sure that your information reaches them, working with local leaders. Again, that's another key thing that we've learned is, how can we partner with our local site leader and who can pick up some of the wellbeing initiatives and say, hey, I hope you saw this. This is also for us. I'm looking forward to taking part in this. Why don't you join me? So helping employees understand that actually this message that went out actually did apply to them. It was for them as well. It's not this assumption of, oh, it's nice that they're doing that, but that's probably for somebody else. It really makes it relevant for them.
And Caroline, I remember you were mentioning in terms of maybe some of your leaders as well sharing their own stories where they might have had mental health challenges, because that again sets that culture of openness, and that then starts to sort of make it less sort of, oh, I don't want to be seen to be going on that program because that might have some stigma. And I love your ideas about the wellbeing ambassadors, and I'm just going to link to Charles in just a second, because essentially what you're saying is it's about creating a wellbeing and inclusive culture. And Charles, you are head of wellbeing solutions at Aon. A large financial service companies bring you in for your support to try and improve employees' mental health. So what, in your experience, Charles, do you feel has made the biggest difference in organisations being able to provide effective wellbeing services? What have you seen in terms of trying to level up in inequalities?
Thanks, Julia, and another really big question. Without necessarily a very short or straightforward answer. I think when it comes to health and well-being, diversity, equity, and inclusion, I think what we're talking about here today is just such a beautiful meeting point. And I think that's a trend I'm increasingly seeing in organizations, which for me is a real positive, because we are starting to engage different stakeholders, bringing different people together who all have an interest and influence over how we look after our employees. But I think ultimately, you know, in the organizations I've worked with, where we've had the biggest impact is where we start at the very top. And I think we've already mentioned in today's discussion how important it is for our leaders to be vulnerable themselves as well. We often refer to kind of lowering that waterline, kind of what we see, you know, above the water, the iceberg, but actually let's share with colleagues a bit more of us personally that might not always be visible. And it's been so effective where I've seen leaders do that. That's not easy. It's much easier said than done. Our leaders often themselves, you know, worried about stigma and how they'll be perceived in the organization. We also need to bring them along on this journey, but that's absolutely worth doing because they set the tone for the rest of the organization. I also think that we need to recognize that we're all stakeholders in improving diversity, equity, inclusion, and well-being in our organizations. As much as the organization and our leaders have responsibility, our employees as well have responsibility. Us, you know, working for the organization, to kind of attend the events, to be more interested, to put up your hand if you need help. But of course, our line managers, that kind of middle layer, is equally vitally important. Having the kind of skill, the confidence to be able to have those conversations with their team members is just so important. But I want to go back to the top quickly, just about you know, our senior leaders. And any health and wellbeing strategy, I think, that tries to really make a difference needs to take a strategic approach. And by that I mean, be really clear about what it is that you are looking to achieve. Often I see kind of scattergun approaches to well-being. Let's just put on an event. Let's just, you know, and there's no real focus. And actually, when we take a strategic view and we agree between ourselves what the key performance indicators are, then we have far greater success. I also think that we need to have the board responsible for the health of the workforce. So often it's seen as a human resources issue, or, you know, the head of D&I will deal with that. Whereas actually, ultimately for this, the buck does need to stop at the board. And so many challenges that we face in this space, maybe it not getting the right attention in the organization, because there's always change, there's always other priorities, isn't there? You know, really starts to get helped when the board's responsible. Same with budget. The reality is many things that we need to achieve are free if we do them ourselves internally, but sometimes we do actually have to spend money and bring in external expertise, whether that's, you know, benefit services and support, or perhaps education programs. So budget and having an appropriate budget, I think, is really important as well. I guess what I'm talking about also here is us changing the culture of the organization. That does not happen overnight. But, you know, imagine, and I know, Caroline, you spoke so beautifully about kind of what a great place, you know, you work in. And I feel really fortunate that, you know, I feel the same at Aon. It's not always been like that for me in my career. I've not always felt, you know, comfortable and safe in my work environment. That culture of people being able to talk much more openly about whatever issue they might be facing, where we've tackled the stigma around difficult topics, where everyone's very clear that it's not okay to discriminate against other people. And again, where we feel supported, you know that if you put your hand up, you will get the support that you need. That's so vitally important. Mm-hmm. The other cultural piece, and are you giving me a time check, which is thanks for keeping me on track. The other kind of cultural piece that I think we are wary of talking about is work-related stress, depression, and anxiety. And I'd love to live in a world where actually, and a lot of what we're talking about today, I think, is, You know, when you come from a certain culture environment, or when at home you can't necessarily speak up, you can't really open up. How awesome would it be if we came to work to get healthier? You know, how brilliant would it be if that is the place where we can go to really be ourselves and open up and be supported? But unfortunately, we know from statistics that because we put too much pressure on people, and because there are still strained relationships in our workplaces, work-related stress, depression, and anxiety levels are going through the roof. COVID-19 has also really had a significant impact on that. We have to think about how workplaces might be making people ill. Start at home first and try to tackle that really important issue.
Absolutely. Thank you very much for that. It's so many really vital messages in there, Charles. And in terms of thinking, how about coming to work where we can actually make a difference, where it can be a place where we almost go to get support and to get help. And there's that quote from Desmond Tutu, you know, rather than sort of like fishing people out of the river, we need to be going upstream to see what's pushing them in the river. And in organizations, we're in positions to be able to do that. And that's such a wonderful kind of idea of getting that open culture and making people feel safe in talking about things. And the talking is the key thing, isn't it? Because we quite often think we know what other people are feeling. So we might think, oh, if we're sort of trying to promote equality and diversity and better mental health, we kind of, maybe we know the right things, but actually how can we begin to know the right things without talking to everybody, without really getting stories? And I think one of the things that would be really helpful is to check in with Jackie Wilmhurst, because as a chartered psychologist, we know that you have experience of working with people and with neurodiversity, both professionally, but also in your role of a psychologist, but also personally. And I'm just wondering if you could share with us a bit about your story and about some of the things that you feel organizations can do to really help level up that inequality in terms of mental health and well-being for people who have different neurodiverse backgrounds.
Yes, absolutely. So hi again, everybody. I'm going to go back a step because I do analogies, and I'm going to give you a quick analogy, and then I'm going to come in because I mentioned health and safety, and that's really just a setup for this. It's a lens I bring around some of the employee wellbeing challenges we face. Health and safety, I talked about prioritising, and health and safety means we don't hurt people in ways that are, crucially by the law, foreseeable. What can we foresee? The analogy I like is a construction site. If we have workers working 10 floors up with machinery and heavy things and things that can fall and so on, if someone asks how we protect their well-being, we will say that we open the way for talks on sleep, nutrition, boosting well-being. They'll say that they have employee benefits they can access and access to healthcare. But if that's where it stops, when someone says, what about if they fall off? And we say, well, we make sure they have access to a doctor, we'd be opening our mouths very wide at this point, because actually we don't just give them access to a doctor when they get hurt. We make sure that we've looked at all of the hazards that could possibly cause them harm. We can't account for all of their personal circumstances, but we can account for their working environment and the work they do, and we can risk assess it, and we can name hazards, and we can involve them in the process. And crucially, they then get PPE, which is fit for the job they do and the workplace they're in. And that PPE can be anything from high-vis vests to harnesses to training in machinery and so on. I bring that forward because there are many hazards. There is now a global standard out, and I'm not going to use this time to talk about that. But increasingly, thankfully, as well as it obviously being the right thing to do morally to look after our employees, and as well as it being very good for business, because we know that happy, well, and included employees are good for business, it is a legal imperative. So I'll park that to say that within that, when we say hazards are foreseeable, that can feel a bit intangible. With construction workers, we do know that falling 10 flights because they weren't clipped on, or somebody dropped a brick on their head or whatever is reasonably tangible. But when we're in workplaces, the ways in which we can be harmed psychologically can feel a bit overly daunting. We do have great work on stress management standards. Charles mentioned that, at least someone else did. There are some brilliant things, but I'm going to home in on the D&I, the diversity issue that's very personal to me, which is that I'm on the autism spectrum. And if I could have a penny for the number of people in my life who's told me I don't seem like it, and I always wonder where their portable MRI scanner is. My brain processes things in a way that isn't within the statistical norm. Of course, we're all unique. Of course, we're all different. But when workplaces are set up for norms, because to be fair, they kind of need to be in the first instance. because we've got to try and work out what the common denominators are. How do people work well together? How do people communicate? How can meetings best be efficient? Because we need the businesses to be profitable or to have the right outputs if it's not profit making. So we can look at all of this, but actually, for me personally, some of the things I've seen happen is companies can get caught up in processes and policies, which, by the way, need to be there. And I'll give you a very concrete example, which is I've been in organizations where, and I've been employed, I choose to be a consultant now for a whole host of reasons. I feel like I've more impact that way, but also because actually at this point in time where we are with the evolution of this particular area of inclusion, we're not far enough for me to feel particularly happy employed. And that's not one individual employer or even an individual sector, it's where I've brought my choice. So I hear people say, we'll offer you a voice, and I don't need anyone to give me a voice. I have a voice more than some people might like sometimes. My voice is right out there. What I would like is for people to both genuinely hear the voice and act on it, because inside workplaces, I have always been someone that will speak up. So concrete examples, being in an organization, luckily, because I work in wellbeing, I often have got that platform to be that leader. I've been a global head of wellbeing who's spoken very personally about my own journey. But also just in different circumstances when I've said, hey, look, I process information in a way that is quite verbal. I think verbally. So if I'm told to go away and think about a problem quietly, it's not going to get solved. It's something I need from people. Conversely, though, I'm not an auditory processor. When somebody else speaks to me, if you did have a portable MRI scanner, you wouldn't see many lights going on. I have to work very hard at that. And yet I need other people to be willing to speak with and listen with me. So when I bring that into organizations, I can find that people have then sent me on a mandatory referral to occupational health doctor to verify that that is indeed what I need with my condition, so that the doctor can write a report. Now, do I have a problem with occupational health referrals as part of organizational processes to assist me and the organization to understand? No, I have no problem. But putting the person at the heart, if I could put it in a nugget, of any process needs to keep being an imperative, because I can speak for myself. I don't need a doctor to say what my adjustments might be. And I don't need or want to be the special case whereby the processes that for meetings, it's made clear that I'm having reasonable adjustments made to me because I'm different. So the sort of policy of universal design, which again, incredibly simple, not necessarily easy, meaning we can all work to our strengths, but we do all have to compromise. As somebody with what actually by law is a legal disability, I don't expect everyone to meet me where I am. What I hope for is to be met in the middle, because I've spent my career meeting everybody else where they are, and it turns out I can do it. But here's the major intersection. I can't do it and preserve my mental health and well-being. I can only do it at such great energy and cost to me that in the end, I'll burn out faster than most. So what I look for is organizations in which it is, and it's been mentioned before, everyone's a stakeholder. I happen to bring a health and safety lens because I think it sometimes is helpful to say, these are literally hazards. A lack of inclusion is a hazard to my health. I can be injured by it. It's not necessarily that I feel disabled within myself, but I may feel disabled by my workplace. Another analogy I quite like is I'm left-handed. And sometimes I feel that where we are on this journey now is that I arrive in a workplace and I'm told, congratulations, we absolutely welcome left-handers around here. We appreciate you're a minority, but we're going to make sure you have a voice. And then I go about my business and absolutely everything is right-handed. And when I question that, I'm told, yeah, sure, but the thing is most people are right-handed. So it's kind of handy if you could just do that while we figure out your adjustments. And we'll see about helping you be left-handed in a few sort of special places. And I find that quite a powerful analogy because it's obvious how disabled I would be by that when being left-handed is not a disability. So that's a bit of a whistle stop for, an example really of how we can sometimes have a different lens on this. But I think if I could really summarize that, to go back to what Julia said, is I don't just want a voice and I don't need anyone to give me a voice. What I'd like is those conversations to be ones in which we're all in them and we're all actually creating change from them. I don't want to be a special case. And I do also know that I have a research psychology background, all of the literature out there supports the fact if we design workplaces this way, then everybody benefits. There's a lot of stuff in education in schools that when children are able to learn in the ways that work for them, still have to cater for the fact that teachers have lots of children, bosses in workplaces have lots of people to look after. We've all got to compromise. But when design is done with the idea that we have huge diversity of every kind, everybody benefits from it, not just those of us who are seeking to have more, nearly said more of a voice, but more of a voice that leads to action. So I'll stop that there.
Thank you so much, Jackie. It's more of a voice that needs to be heard, is it? More a voice that is heard and acted upon, and that's the key difference. And it's you have to meet people where they are, but now you're saying actually meet me halfway, and you've given some kind of really quite interesting examples and analogies about what that looks like. And it's really about listening, because we cannot know what it's like for other people. Thank you, Jackie, for sharing that. And Sandra, you told us before the event that employers and policymakers have never really focused on this issue. What kind of things have you seen make a difference, and what advice do you have for how managers can support those who have faced exclusion due to the intersectionality of gender, race, and mental health and other protected characteristics?
Thank you. Thank you. I think the key thing on this is for employers to be aware. So I'll share something. When the pandemic hit, as I say, there was already a disparity, and they started talking about there's going to be an economic impact. And I know from 2008, because I was doing this role in 2008, when we had the financial crash, 2 years on, when that was over and everyone's like, oh, thank you, we're bounced back, it's all over. 60% of Black, Asian, mixed race, ethnically diverse people, 60% had no savings at all. Because they started off on low pay, they don't have the finance to manage financial shocks. And we know those are some of the things that are stressors and causes of anxiety and mental health challenges. So when I really recognize, and many still haven't recovered, I've spoken to people who say they still haven't recovered from the first financial crash, and the economic impact and concerns and anxiety about what's going to happen now. So employers really need to be aware that they might think, well, I pay my people all right, but they may be partnered with people who work in different sectors, frontline services. We've heard Amanda talk about the NHS and the disproportionate impact of people on the front line with COVID, hence the disproportionate volume of deaths. Cramped housing is another one. So we know through data, so the Government Ethnicity Facts and Figures website, worth having a look at, shows all the data by ethnicity group, and ethnicity groups more likely to be in some into social housing, higher housing costs, and all of that knock-on effect that happens when things go wrong, when things, I'm sure all of us have noticed, things going up a bit in the shops, but we can still go to get what we need. But for some people, that's a huge domino effect. And one of the things actually we've seen recently in our local community is the food bank. Last week, it was like double the amount of people who turned up at our local food bank that we set up during the pandemic. So I think employers need to be aware that those are things that cause mental health issues. If they're partnered, again, here's some of the other disparities, more likely to be on 0-hour contracts, so unstable work, doing shifts and working for agencies. Many do that because it pays better, opposed to it's really a life choice. And then also the other thing that Amanda alluded to, and it doesn't only exist on ethnicity, is discrimination in the workplace. Bullying, harassment, feeling of, I don't feel included, I don't feel like I belong, I don't feel like I can talk to anybody in my organization, and what the ripple effect of that is. And we have just launched our report. We had a report that we launched last week with a big survey on race in the workplace. And it shows that not only have there been an increase in people feeling bullying, harassment from kind of, in the workplace, that's kind of been remained static, but customers and clients and service users as well. So that's another layer of pressures that are often invisible because people just get on with their jobs, but actually it really matters that employers have policy action in place to enable that employees feel safe. So I think one of the things employers should do is not only have their policies, but actually have a plan and a transparency about how does this get enacted, so that individuals feel like if I'm coming to work and I'm trying to serve people, if something goes wrong, I'm going to be safe. Another thing Amanda already touched on was the safe spaces, and we produced a toolkit in this kind of pandemic for managers and individuals. And one of the things that we've said for line managers particularly, because that is the closest relationship that individuals have, is to create that safe space so that check in, you know, just ask. And I think the future is leaders being brave and being comfortable with not having all the answers. I mean, who doesn't have all the answers? It's okay not to have them all, but you can put your heads together and say, right, what are we going to do? How can we support this? I think the second thing that's really important and we know works. So we talk about, you know, employee assistance programs, and employers have put up, some have got ambassadors, and lots of connected with mental health first aid, and others have provided maybe actually even subsidized support. It's really ensuring that your employees have access to it and have access to it. And I think it's, you know, the role of the manager is to check in and say, do you know that these things are existing? Do you think it will be of help? And if necessary, help the person to do the application or whatever the actions are, because that would get rid of one additional pressure. And then I think it's really been touched on that one of the things we know through our survey is that actually when we ask the question about do you want to progress, this is 70% of ethnically diverse people say yes, please. And we know through data that actually Black and Asian people are more likely to be at lower levels in organizations. So if you think about all the financial pressures I've talked about, progression has got to be something that is attractive, an opportunity to get into more stable work. So I think anything that an employer can do is having that conversation, getting to understand what the aspirations are and seeing where there are opportunities for them to develop the skills, show their talents, and, you know, so that there's an opportunity to progress. And then I've also put here about being jointly coming to the solutions together. So really active listening. And it's interesting what Jackie was saying about voice, because actually on ethnicity, this is a big thing, I think, for people to actively listen, enable people to feel safe to speak up and not feel, oh, if I do it's career death and I'm going to be, you know, harassed if I tell the truth or whatever, creating that environment. And then also being empathetic and actually don't underestimate the power of just listening, because sometimes the action may be, thank you, I don't want you to do anything, I just want you to know, so that you can be sensitive and, you know, understand particularly, you know, and I think I'm going to finish here because I know everyone's been talking at you and there's an opportunity to ask some questions. I think there's a real powerful piece around giving being open yourself. You know, I think that's touched on as lead, that I don't know the answers, but I do want to help. I do want to understand better, you know, help me, and what might we do, and can we check in again? You know, it's just such a, people want to exhale when they feel like somebody cares, somebody's noticed that there's a problem. And I'm just going to finish with this, that when as I say, the reason why I was quite shocked when I saw the 29%, because I know that there is a kind of a taboo on mental health. So we started at the beginning, this does need to be in a parity with physical health. There's a stigma about talking about mental health. So therefore we need to switch the light on, create safe spaces, be vulnerable and open ourselves, and then action plan together so that employees feel this organization actually cares about me. I can tell them what's going on with me, and if they can help me, they will. But actually, what a relief to be able to share with somebody that I need some support right now, or could I just have a bit of more space right now, or a bit of flexibility right now to just enable me to manage my life and manage myself through this crisis. Thank you.
Thank you, Sandra. Gosh, there's so much to take in there, but I just think some of the key things that I heard there was, it's about leaders being brave and admitting we don't have all the answers. We need to ask the questions and we need to listen. And you saying there needs to be safe space for discussions, ensure that people have access to and have accessed mental health support. And it's almost being aware of that, the taboo in talking about mental health. And then on top of that, sometimes it can be difficult to talk about some of the other unprotected characteristics as well, for fear of people getting it wrong. So it's about asking the questions, saying, I might get it wrong. I might get it wrong. If I get it wrong, tell me. But at least I'm asking the questions and I'm listening, and I'm really listening to what you're telling me, rather than pretending that there is no issue here and that there is no disparity. Fantastic. Thank you, everyone from our panel. We're going to open it up for questions in just 5 minutes. But just before we do that, I'm going to ask all the panel members just to give just two things. What is the most overlooked mental health inequality that you've seen? And what is the one thing that you have seen work to level up inequalities in employers' mental health? So you just have just under a minute each to say something about that. So if I can start, could I start with you, Charles? Is that okay? And it's just one, maximum 40 seconds.
Okay. So here goes. I think in terms of overlooked inequalities, first of all, there's a wide scope of different ways that there's been inequality from a mental health perspective. We don't always know all of the answers. It can feel overwhelming from an employer perspective. My tip here is look at your data, try and understand where the issues are in your particular business. I'll give you one example. Some research I've done throughout throughout COVID has shown that line managers have been disproportionately affected because they've had to step up and support everyone else, put themselves out of their comfort zones, have really difficult conversations. They're not always trained for that. Doesn't always come naturally to them. The key thing I would say to kind of help level this is put the inclusion back into diversity and inclusion. It's no good having a diverse workforce, but not an inclusive one.
Thanks, Charles. I'll have to chop you off. I'm so sorry. Jackie, just 20 seconds. Let's just go with the key thing that you have seen to work best to level up inequalities in employees' mental health. Thank you, Charles. Thanks, Jackie.
So for me, it's when alongside benefits, chances for me to bring my whole personal stuff that goes on for me and access resources, to know that my workplace has also looked policy, procedure, strategy, all of it, and invited me in the things that could harm me at work. So health and safety, not just benefits in HR. That's when we've got all of it, is how people can reduce the chance of getting hurt by work.
Thank you, Jackie. Sandra, the one thing that you've seen make the biggest to work to level up some of the inequalities we've seen.
So I think the biggest overlooked thing is ethnicity and gender, that intersection in mental health, just nothing at all. Two things together, starting that conversation and following through with an action. I don't care how small it is, but doing something following that conversation to demonstrate that you've heard what's been said.
Thank you very much, Sandra. And finally, Caroline.
I think for me, one of the keys is kind of that middle management, and I think that Charles sort of alluded to it. I think it's very easy if you're a leader to talk at high levels about the importance, be it of well-being, diversity, inclusion. If you're an employee, there's sort of, your job is to, in a way, take care of yourself. So you have people at the top saying this is important, people at the bottom saying leaders said it's important, what are you guys doing about it? But then you have those folks stuck in the middle who, they still have to make their numbers, but they aren't given, I guess, the tools or the training or the access to how can they support their employees without it damaging their own mental well-being. And they're the ones who are the closest to the ground, I think, can have the biggest impact. So I think we need to really focus on them to reach everyone else.
Thank you very much, Caroline. And thank you for listening. We're going to open everything up for questions now in terms of our networking event. So for those of you who are leaving the panel event now, we really look forward to following up with your thoughts later. And Laura, Head of Partnership, will be contacting you to get your feedback and your ideas within the next week. Great to have met you, and goodbye to those of you who are leaving. But to those of us who are staying, we now have 30 minutes of informal questions and answers to share and to get to probe deeper into some of the things we've heard the panelists say, to share your own strategy to increasing equality and around mental health and well-being in your organisations. So great to see so many people staying. I think what we'd ask is, could you please all turn your cameras on? I know we'll have loads of faces, but it'd be so nice to see everybody. And we're just going to have an informal question and answer session, which I'll start off in just a minute, looking at some of the questions that have come in, but let's just see who we've got here already. If everyone can turn their cameras on.
And if anybody has a question, there's a function to raise a hand on Zoom. So if you just want to click that, if you'd like to have your camera on to ask a question.
Okay.
And thank you so much to our panelists. That was so interesting. And I know that everybody's going to have lots of questions. If you'd like to stay on, that's absolutely wonderful, but I appreciate that your time is very precious. So thank you ever so much for joining us today.
I'm just going to start. I've got a question here that's come in from Lynn Rue. Lynn, are you around? Hopefully I've seen on the chat. What would the panel suggest are the top 2 things an employer can do to create a workplace that demonstrates that it's okay to be not okay? What a fantastic question. I'm going to put that over to, is there anybody who particularly wants to grab that of the panelists, if you just want to raise your hand? So I'm going to Charles, I was going to put it to you actually, Charles. So brilliant. I didn't want, but thank you, Lynn, and it's lovely to see you. So Charles, what are the top 2 things an employer can do to create a workplace that demonstrates it's not okay? It's okay to not be okay.
So I don't have the clock issue again. I'll take one.
You can go for it now.
I think one is, certainly the power of storytelling. And we've done that really effectively in our organisation, where we created a video of colleagues sharing their mental health experiences and wide-ranging issues, some kind of hard-hitting issues as well, talking about issues like depression and suicide and personality disorders, feeling anxious and stressed at work, and those kind of things. We some of you might have heard of the Lord Mayor of London's This Is Me campaign. So that's kind of what we really embrace as a firm. And when we created and then launched that video in 2016, it was the most watched and most liked video that we have ever shared in our firm. And it really sent to us such a strong message of that kind of power of storytelling, people being vulnerable, and so many colleagues reaching out, talking about how they can relate to colleagues' experiences. The beauty about it is also we asked, our colleagues who shared their stories afterwards, a few months later, what the impact was on them, have people treated them differently, and actually consistently it was a positive experience for them. To me, that is just, fantastic, because we are all so worried about talking about this, worried about being discriminated. Are people going to look at us differently? And actually, I think storytelling is such a great way of saying it's okay not to be okay. I'll quickly say, I touched on leadership earlier on, and I saw a question about leaders and what kind of level of leader you can reach. In our video, we did have someone relatively senior in the firm as well. That can be really impactful. It's not all about leaders. Different colleagues want to see people, who are like them, but also be inspired by people who've been successful and have shown that actually this has not hampered their career at all. So that's just one thing that I've seen work really well.
Thank you, Charles. Fantastic. And the question that we've got to come in as well, when you talk about leaders sharing their stories, what level of leaders have you been able to reach? And Jackie, am I right in thinking you would like to pick this one up?
Very happy to, because I mentioned that even though I work primarily as a consultant now, I've been in roles. I've spoken up as a global leader, a global head of wellbeing in a large global company. But when I say I've spoken, I mean, I actually have challenged fellow leaders at my level. And one thing about being autistic is I don't always feel I have a choice about how honest I am, but I've learned to be polite and respectful. But what I have done is I've been able to challenge with tangible examples, meaning that there's been that understanding that we need to be inclusive, have representation of the whole diversity of humans. But day by day, what on earth does that look like? And I've been able to say to another leader, what it looks like day by day is that you honor these needs of mine in how we communicate, and you will honor the fact that, yes, there are ways that this company needs to be efficient. But to get the best out of me, I need these things. And I don't mean that each conversation with my manager was visible to everybody else. However, he was very open to me challenging the leadership at that level as part of it. And I wanted to use that platform. And I know that that had a big effect, because I received quite a large number of, there was a diversity event at which I spoke out. I received quite a large number of individual emails from people who said, we haven't come out, as it were, as neurodivergent. We don't necessarily quite feel safe to do so yet, but we do feel like we're in the right organization if this is the conversations that are happening. So I know the power of that working. I appreciate not everyone has instant access to the top leadership team in an organization so easily. So that would just be my feedback of how well it can work, because it's tangible. And my own manager did say later that it had opened his eyes to something that he hadn't appreciated before.
Thank you very much, Jackie. Thank you. And there's a question coming from Leanne. So Leanne Young, thank you, Leanne. How could employers give credence to health and wellbeing and the individuals pushing the agenda in the workplace? Should they employ health and wellbeing professionals? It's often an add-on to existing roles. I'm just wondering who would like to take that. Any ideas on that, Caroline, and your thoughts on that? Am I able to hand that over to you?
Sure, I will try and give an answer to that. So I think that, Leanne makes a good point, and certainly, up until this current role that I'm in, she's right. I think wellbeing professionals, or the wellbeing role, was often a this, and this, and wellbeing. And there's no doubt that, if it's just an add-on to somebody's day job, you're not giving it the attention or the credibility or the buy-in that you need. I think that there are two things that you need to do. Is A, I'm very fortunate. I was hired to lead wellbeing at JM. So that in itself, the company's making a statement. We've created a headcount for this. And I think that makes a big statement. The other thing is, I wasn't just hired out of the blue. I was hired because, pre to me, they'd agreed that wellbeing was important. There was a strategy that, how did we define wellbeing? It was, shared and bought into and subscribed to by, the management committee, by the leadership. So we had buy-in from the top down, and then I was hired as proof of that buy-in, which of course made my job a lot easier. But I think it does, give credibility to the fact that we have, gone to the trouble of building a network of wellbeing ambassadors, and it's the front, and we have an agenda of wellbeing programs and a strategy for every year and areas of focus. So I think that is absolutely, how you give credibility to wellbeing. There's always, of course, more to do, but I think that absolutely it has to be a well thought out program. It's not just a, oh, there's COVID, what can we label as well-being? Oh, a few people have made some noise, what can we label as a well-being program? You should be, in a way, prepared, and you should have the programs and you have the expertise, so that actually you don't want to necessarily preempt an epidemic, because we didn't know that was going to happen, but we had the tools, we had the credibility, we had the resources in place. And I think that's, what makes a really big difference. Does that help answer the question?
Thank you. Thank you, Caroline. Jackie.
I was going to say, I'd love to add to that, if I may, because it's an and rather than an instead of. It's that on top of all of that, where I come in with the health and safety angle that really helps is that it is actually a legal requirement to look at how, I realise that mental health is much bigger than workplaces, but what's been missed is that it is a legal requirement for workplaces to identify and risk assess anything that could, the word is foreseeable, anything that could foreseeably harm employees. It hasn't been done because, frankly, there hasn't been the guidance, and employers would have found it very difficult to do so. So on top of all of the good things, one of the ways to be heard, and it's where I bang my drum on the professional side, rather than the diversity issue I've been brought here, which is for me more personal, but part of it. On my professional practice is to say, this is actually a requirement systemically. And now that there's a global standard out, when the auditors come in and say, can you show us your strategy for psychological health and safety, your risk register, your policies and procedures, and your control measures to mitigate those risks that are foreseeable, where are they? And luckily, it's not to make employers panic. There is guidance now, and it's going to get audited. So that really, really does help to businesses to appreciate that, yes, it's good for business, it's morally right, but it's also a legal imperative. And the more that gets out there, the more action there also is in that sphere.
And a great question about that from Lynn. Where can we find this global standard, Jackie, that you're referring to? What is this, and where can we find it?
I've been so conscious of time, I haven't wanted to go off on a great big tangent about those details, but of course, it's called ISO 45003. And so it is a global standard for psychological health and safety in the workplace. And it was launched in June this year. If you Google it, it should come up. It's designed to sit within, so most global companies certainly would follow a standard. You know, with physical health and safety, you don't want to have to do different things in different countries for different legal requirements. ISO 45001 is one of the global management systems in health and safety across the standard. This is designed to sit within it, but it can still work if you're not using a global standard. It's basically guiding you through the stuff we've talked about today, including leadership, engagement, different stakeholders, but also how do you meaningfully map out and audit yourself and say which of the many, many, many things that could impact our employees' mental health are foreseeable and originate in the workplace. Lack of inclusion is one, but we talked about bullying and harassment, which may or may not relate to diversity and inclusion, but actually also stress management factors that we know. And also, again, I didn't mention, I do quite a lot of work with the social media industry, because one very obvious workforce that's growing all the time is the content moderators that remove the nasty stuff off the platform so that we and our children don't see them. That's hazardous. And it wasn't always seen that way. It was seen as we just need to give them more benefits, point them to an EAP. That's not good enough. An EAP is a benefit. So what instead has to happen is we say, actually, that's a foreseeable risk in their work. How do we therefore risk assess it? I won't go off into all the detail of how we do that, but the standard helps to frame all of that and helps organizations to, as we say, to audit themselves before someone comes in. That said, I know the people who do the audits from the health and safety exec, they don't come in to find fault. They come in to give help and notice of improvements. So whole host of stuff to be found on that, but I'd see it as a huge help, this new standard, rather than something to be hopefully overly worried about, because it gives so much more structure to these things. And it really increases parity, because it says, in the same way that you must not allow the workplace or the nature of the work to hurt your employees physically, you're now going to do that the same for the mental health side. But as I mentioned before, it doesn't remove any of what my fabulous fellow panelists have said about we all have histories and lives outside work too, and all this brilliant stuff going on.
It's great to have that, and thank you. And I know Laura and Adriana have put that in the chat in terms of the link to that. I think something that's so it's a tangible thing, isn't it? A lot of what we're talking about is sort of health and well-being and inequalities, and it's intangible. To have something tangible to say, actually, the criteria that we're measuring against here to make sure that people are included and there is parity and people are not going to be at harm for being unequally treated and included or heard, is something that's really quite a useful thing. And also to have that then to fitting in with the culture of leadership. And I know you were talking about, and Caroline, you talked about leaders right at the top, and Charles, you mentioned about leadership, and you mentioned when we were talking before about leaders being open and sharing their own stories. So it's that kind of creating that psychological culture. We've got some things coming in terms of people getting some followers, Jackie, in terms of people wanting to chat with you about the health and safety and connect. So that would be great, and to pick those things up. So I'm just wondering, are there any other questions from the panelists for each other? Would you want to ask us, having heard little sort of snippets of each other's stories, is there something you would like a little bit more information on between each other? So Jackie or Caroline or Charles, Amanda, something that someone has said that you actually think, actually, could you tell me a little bit more about that?
I've got my hand up, if I can.
Oh, sorry, Charles. You're in the top left. I was looking. They're very small as well. It's a very small hand. Charles, thank you.
I guess my question relates a little bit back to the question that Leanne asked earlier on about, doing well-being of the side of your desk. And for me, the big question is, how do we get business leaders to see mental health and well-being as a strategic priority for the business? I think Jackie spoke so well about kind of that health and safety, angle, because employers have to do it. You're legally obliged to, and if you think of, how businesses are run, you have strategies for financial risk, cyber risk, natural disasters. Why not a strategy for health risk? If we recognize that kind of health has a negative impact on performance, absence, presenteeism, all that stuff, legal claims, it also has a really positive impact if you get it right. You know, improved happiness, engagement, performance, all of that stuff. And my question's for Caroline, really, in that, you know, sorry, not putting you on the spot, but, you know, I love kind of what Amanda was talking about, you know, having a psychologist. I think every organization should have a chief wellbeing officer. I mean, the reality is many people get given this as something off the side of their desk. You've got the first-hand experience, I guess, of being a global head of health and well-being. What would you do to encourage other organizations to invest in similar roles?
Good question. I mean, for me, it's, you know, in many ways, the little things. You know, I got an email the other day from an employee thanking us for the wellbeing initiatives because it had reminded her how important it was to take care of herself. You know, you sort of, when you have those kind of comments or that kind of feedback, you know that you're doing something right. And that's one of, you know, we have 15,000 employees. And I know that might sound a little bit sort of touchy-feely when you sort of say things like that, but that is actually what we're trying to achieve is, you know, supporting and reminding our employees that it's okay to take care of themselves. It's okay to bring their whole selves to work, whether that's, you know, anything relating to their background, both from an ethnicity point of view, from an ability point of view, from a mental health point of view, from, you know, all of those areas. And I think that that's, you know, why there's so much value in investing in. I think you're making a statement, which is, this is important. We've got somebody here, not it's an afterthought because we've read somewhere that it's important. So, and it impacts the bottom line. I think that there's absolutely no doubt. To me, you know, and of course, you know, I come from a background of, from a benefits point of view, so you're more traditional insured benefits. And why would you wait until something goes wrong to support your employees? And that's what I always sort of say, you know, we should be helping our employees stay well, or when they start to struggle, not wait until something dramatic has happened to them, whether it's because they're off sick because they've had a mental health crisis, whether it's because they didn't feel that they had the time or whatever it is, even to deal with the physical health issues, although I know that's, you know, less controversial and more openly spoken about. And I think that's the thing is, you know, and I always sort of say it's easy as an employer, especially you're a large employer like JM, to sweep in with a hero move, right? So, oh my God, this thing has happened. That's okay. We'll throw all this money at that particular person's particular thing that came to the surface because, you know, that makes us kind of feel good about ourselves. But to me, the question is, what did we do in the first place to prevent that person or that employee getting to that state in the first place? And I think that's where investing in well-being, be it through headcount programs, working with vendors, etc., that's where you make the big difference. Is you are caring for your employees because it's the right thing to do, not because sort of disaster has struck. If that sort of makes sense. And I don't know if that sort of answers your question, Charles.
Thank you so much. No, that's great. If I may ask a quick, short follow-up question, and actually for anyone, about kind of demonstrating the impact of the work that we do and what we're talking about here today. Has anyone seen any really good examples of kind of that value on investment or kind of return on investment? Is there anything out there that you know, we've used practically in businesses? Because I often get asked about that, and I know organizations approach this from different angles. Some don't have to justify their spend, and others do.
I could come in there if that's going to work.
Okay,
Two things at two different levels. I've had to do a lot of work in the metrics for all the right reasons. Sometimes that lens shift is that one metric could be, rather than looking at the ROI, or I'm a big fan of VOI, Charles, that new lens can sometimes be legal compliant versus not legally compliant, and that's a metric. However, that's at the systemic level. Zooming all the way to the employee level, something else I found, because I have a background, my applied research was health, quite strongly health related, is that because a lot of what we do around health and well-being is not necessarily training, but it's equipping employees through sessions of different kinds or interventions. there are some really good, well-validated metrics on health behaviour change. And what I mean by that is we know that trying to measure what behaviours are people engaging in to take care of their own health before this, we can't then follow them around and measure their behaviours later. We can ask, so what tends to happen is we give them the happy sheets. Did you enjoy the session? Did it make you feel shiny and good? And all the behaviour change models, without going too deeply into it, recognise that if you increase motivation without some other things, you get people spinning in circles and not quite sure what to do next. In summary, there are some really good metrics, but what they do is they gather the information that says we've just markedly increased the probability of people's behaviour changing. We didn't just motivate them and make them feel really interested and desperately want to look after themselves. We've equipped them with things that are now, they are scientifically validated as behaviour change, and they're really easy and they're really short, and most workplaces don't know about them. And I've used them in neurodiversity space, I've used them in health and wellbeing space. So that would be one example. I realise there are so many more things we have to measure, but if that helps.
I'm just going to pick that up in terms of, I think it links us all back to the whole overall strategy, doesn't it? In terms of if we are going to do any of these interventions, if we are going to set somebody in a post to be maybe an inclusivity or health and wellbeing champion, there needs to be a strategy that is looking at how that works, and it's going to be part of appraisals, almost a part of how much the service is used, how people have found it helpful, and all of these things to be built into the whole criteria of what makes our organisational strategy and our organisational processes. It's not, there's nothing worse than a sort of a tick box type thing and then just kind of going away and everybody just feels a bit sort of ruffled and they don't really quite know what's going on and what they're supposed to do. So it's keeping that messaging, keeping the leaders modeling the type of behaviors that they want. So I'm conscious we've only got a couple of minutes left. So I'm going to just sort of finish with some of the key things that I've picked out that have really been the nugget of what makes the difference in helping to start levelling up some of those inequalities in mental health. It's a big challenge, but the things are, the things that people have said are linked to the global standard health and safety that you were talking about, Jackie. Have a strategy for health risk. Make sure the leaders are absolutely bought into that in every area, into equality and diversity and mental health. Have leaders champion and share that kind of openness, so this is a safe place to speak. Have psychological safety and really listen. Ask people and act. Do at least, if you just follow up and act on one thing, as Sandra's saying, appoint a chief psychologist or a wellbeing officer or somebody who's going to be that champion, not just an add-on, and ensure that everybody has access or has accessed or knows about the resources that are available for people. So they're the key nuggets. Hopefully you've got a lot out of this and the panel have been amazing. I'm going to hand over to Laura just to close the event, but I just want to say what an absolute honour to be involved in hearing all those stories and the tips and the strategies and the concerns and the things that you're sharing and that you've seen going on. And thank you to all the participants for listening. So I'll just hand over to Laura just to close.
Thank you so much, Julie. It's been an absolutely fantastic event. So following on from this, we'll create a report which will have a brilliant highlights video for everybody to go back over, see the main points like Julie's just summarised. We'll put some of the information that was shared as well. We'll pop that into the report. Thank you ever so much for joining. We can't do these events of knowledge sharing without people asking questions, people raising their hands, and without our fantastic panelists offering to share their experiences. So thank you, everybody. And yeah, we look forward to being in touch with everybody in the near future. Have a great day.